rather than my presenting questions to the panel, I am going to begin with your questions. As I told you before, we are going to alternate between the written questions, and I assure you there are quite a few of them up here, and your questions. The first question, this comes from Glendale. Government is already running Medicare and the post office and losing money. Why do you think adding 45 million more insured will help us save money? I think we can begin with the Congressman.
Thank you, and that's an excellent question. I think there are really two costs that we have to be concerned about in any healthcare reform. The cost that the government spends on healthcare, which is one form of expenditure, and the cost that all of us as a nation spend on healthcare, which is also a very important expenditure. And it's certainly a legitimate question to ask, if Medicare is running at a deficit, why won't a new government plan run at a deficit? And the answer is that we have to do both better. We have to effective, and we have to ensure that a public option pays for itself. And in fact, in the legislation before the Congress, and this was very important to the President, it's very important to me as well, we require that the public option be self-sustaining, that it be paid for with the premiums into the public option system. But I want to say one other thing. We have seen, and I think this is driving some of the opposition to the public option, that when you have competition with an efficient public option, it forces the private insurers to do better. So whether you're one of the millions of people without insurance who decide to go for a public option, or whether you're someone who has private insurance they can't afford and decides to go to a public option, the mere fact of a public option will drive down the costs for everyone else. I never promised you were going to agree with me. So this is a value, I think, on the toughest issue which we face, and that is the level of national healthcare expenditures. Because unless we get that under control, we are going to bankrupt this country. So we have to ask not only how do we make Medicare more efficient, how do we bring the cost down and the waste and the abuse within Medicare, and the fraudulent billings and the other problems in Medicare, but we also have to make sure that a public option is run cost effectively and puts downward pressure on the private insurers.